Hello.
Hi, I'm Callie Douglas. I'm a student nurse at USM. How are you?
I'm good. How are you?
I'm great. I'm just going to do some vitals on you today, and I'm going to be doing a skin, hair, and nail assessment as well as a head, ears, eyes, nose, and throat assessment, okay?
Okay.
Do you have any questions so far?
No.
Alrighty. I'm going to go ahead and put this pulse ox on for you. Can you verify your name and date of birth for me?
Diamond Banks, February 28th, 1999.
Alright, awesome. And I'm going to take your blood pressure as well.
Okay.
Is there an arm that you prefer?
Just my right arm, please.
Okay.
It's more comfortable.
Alright, your pulse ox is 98,
Perfect.
which is well within the normal limit. Just slip this in here.
Yeah, you know, I just come here normally once a year. My annual checkup. I try to maintain a healthy life.
Well, that's very, very important because health is wealth, and you take care of it now. You won't have to spend as much time normally taking care of it later, you
I
know?
hope I have good blood pressure.
Well, we'll totally see, okay? All right. All right. Your blood pressure was 112/76, which is within the normal range, so that's
Okay.
great. I'm going to set this aside. I'm going to go ahead and take your pulse as well as your respirations. All right, if you just want to put your hand up here for me. All right. Pulse is around 66, and your respirations were 14 respirations a minute, which is great. Everything's perfect. Let me go ahead and take your temperature. There are no probes, but we'll simulate like we are taking your temp. All right, and your temperature is 98.6, which is well within the normal limits. All righty. Do you have any pain today?
I do not.
All right, that's great. I'm going to go ahead and start your hair assessment.
Awesome.
Have you had any pains or lesions in your hair that you know of?
No, everything's been perfectly fine.
All right. Well, that would make sense because you have a general well-being about you. You seem like you have very good nutrition. Your level of consciousness is awake, alert, and oriented ×3, so that's always great. I'm just palpating to feel for any lesions or lumps. The hair seems to be very healthy. There's no odor. Alrighty. Everything seems to be great with that. Get my glove off. Alright. I'm just going to go ahead and palpate your skin and check for temperature. It seems to be just warm, which is fine. It's not too warm. I'm going to check your nails. They seem to be of good capillary refill, less than 3 seconds, as well as good texture and cleanliness. There's no odor about you, which is always a plus, so that's great. I'm going to go ahead and check on your skin turgor, which she's young, so I could do it down here, but if she was an elderly patient, I would do it by her collarbone. But there's no tinting on either hand, which means you're hydrated, which is great. I'm going to go ahead and start your eye assessment, so if you could take off your glasses for me. Alright, this light may be bright, so just bear with me. Alright, her pupils are dilating at the same pace. They're both doing it very briskly as well. Her sclera is white, so it's no indication of jaundice. And could you do this for me? And underneath her eye is pink, so that's great. I'm also going to check for your red reflex, if that's okay. Alright, and both seem to be there, which is great because that means there's no neuro issues. I'm going to check your nose, so if you can just tilt your head back for me. Okay. It's dry, but not too dry. It's a good mixture of moist and dry, and it's pink, which is great. All right, I'm also, sorry, going to go ahead and
it's okay.
check for your mouth and your throat. If you could stick your tongue out and say, All right, thank you. Her teeth, there seems to be no decay. There's no bad odor either. And everything seems to be pink and moist, which is good. Now I'm going to check for your ear canal. I'm going to lift back and up, and I'm going to insert this to check for the tympanic membrane and make sure it's a nice pearly color. Have you had any ear pain lately, Miss Banks?
I have not.
All right, that's good to hear. Everything seems to be just perfect. There's not too much wax. Wax is normal, just to let you know. I know some people freak out about that, but it is normal to have. And next, I'm going to check for your hearing. I'm going to use this tuning fork, and basically I'm just going to hit it and put it behind your ear.
Okay.
And if you hear it, tell me. When you stop hearing it, also tell me, please. Okay?
Okay. Okay, hear it.
All right.
Yep.
Okay.
Yes. Yes.
Okay. And then I'm going to do it one more time.
Yes. Yes.
Okay. That is great. Now I'm going to palpate for your lymph nodes just to see if there's any signs of inflammation or any masses. Have you felt any pain in your lymph
No,
nodes?
ma'am.
Okay. Seems to be fine. I don't feel anything abnormal. If you could, I'm going to check for your thymus. Swallow for me. All right, swallow one more time. All right. There seems to be no abnormalities or inflammation, so that's good. Your trachea seems to be midline, which means there's no pneumothorax, which is great. Your nose and your eyes are midline. You seem to have a very good general well-being about yourself, which is always so great, I know. Okay, well, excuse me, I'm gonna go ahead and take my findings, go bring it to your primary care physician. Is there anything else you need from me?
No,
Okay.
thank you so much. It was nice meeting
It
you.
was so nice to
Thank
meet
you
you
for
too.
this appointment. See you next year.
Yes, ma'am.